Okay, so let's look at some of the things we see when an animal is hypothyroid. The animal can be overweight, as I mentioned before. It can be lethargic. It doesn't have normal energy. It's really blah. It can hate the cold and it wants to hide, as this dog is, under a blanket. Especially in the Orient, you wouldn't expect that to happen. And if you look at this little beagle hiding under the blanket to keep warm, she's got anxiety in her eyes. See, she's anxious looking. She looks frightened. She's definitely anxious and she's cold. Now, she may be aggressive if you suddenly try to take off the blanket and pick her up because she doesn't want to be pestered with or she wants to just hide, basically. So here we have, look at the eyes. This is really important. If you look at this hypothyroid Malamute, the eyes look tragic and sad and anxious. A little bit of just not doing right. So the majority of dogs with thyroid disease are hypo or have low thyroid hormone, whereas most older cats are hyper and have high thyroid hormone. Now look at this cat. This cat is saying, okay, look at me. I'm going to claw you or bite you if you come near me. So you see the eyes. Look at that. If we're going to test for canine thyroid dysfunction properly, you need the whole thyroid antibody profile, at least initially, so you know what you're dealing with. If you start with just a T4 and that's not enough, and then you have to do a free T4, and then you do a TSH, and then you do the antibodies, you're spending way too much money, meanwhile your dog is suffering. So you need to do the whole thing up front, even though it's going to be more expensive, because in the long run, your animal will benefit, and so in your pocketbook, you won't spend as much money. Now, in the dog, we need the canine version of thyroid-stimulating hormone. However, it's a poor test. We even call it a crappy test, excuse my English. It's poorly predictive. It only accurately measures hypothyroidism in dogs 70% of the time. In humans, the equivalent thyroid-stimulating hormone assay for people is 95% accurate. So when we have a diagnostic test that gives you the wrong answer 30% of the time, it's not useful, and we really should not rely on it. And why is that? Why is the dog different from people? Because the dog has another regulatory way of managing thyroid hormone through growth hormone in the head. So growth hormone regulates thyroid production in the dog about 30% of the time, and the rest of it comes from TSH. Whereas in humans, growth hormone has a minimum effect, less than 5% of controlling human thyroid function. Now, the basic thyroid levels that you're going to measure are affected up to 25%. In other words, a quarter of the levels you're measuring can be changed by steroids, low doses of prednisone. Now we're talking about significant doses of corticosteroids, phenobarbital as an anticonvulsant for epilepsy, sulfonamide antibiotics that are commonly used to treat infections today, although I must tell you, frankly, we don't want to use potentiated sulfonamide antibiotics like trimethoprim sulfamethoxazole or trimethoprim sulfides of any kind in animals these days because they suppress the thyroid. Also, there's a anticonvulsant sulfonamide called zonisamide that also has all those things. Sulfonamides cause rheumatoid arthritis-like symptoms. They can cause necrosis of the liver. They can cause behavioral problems. And to me, as a veterinary hematologist, I'm most concerned about the fact that they can destroy red blood cells and platelets. And so you have autoimmune hemolytic anemia or autoimmune thrombocytopenia when the platelets are too low from using sulfonamide. So obviously we don't want to give them, never mind the fact that they can affect the thyroid. I mean, if you feed too much iodine, that's also a problem. Most commercial pet foods now made throughout the world have a lot of iodine put in them. And they were put in them over the last 15 years or so because so much hypothyroidism was being diagnosed that the pet food industry thought, we can probably prevent some of that by adding more iodine to our foods. And so they added more iodine than animals really need. And then we came along as pet owners and veterinarians, and we said, gee, just to make sure your animal has enough iodine for keeping the thyroid normal, why don't we add seaweed like kelp as a supplement? And so many of us use supplements now, in addition to a basic commercial pet food, that contain iodine in the form of seaweed. Please be very careful. If you're feeding a commercial pet food today with plenty of iodine, whether it's a dog or a cat, please do not feed kelp regularly. Maybe once a week would be okay. If, on the other hand, you make your own pet food, or you're feeding a raw pet food that does not contain iodine supplement, you can feed kelp products 3 times a week even without a problem. And you need enough iodine, but not too little or too much. Basal levels, basic levels of thyroid hormone, are lowered by estrogen, and they're raised by progesterone. So when intact non-spayed females are just about to come into heat, say 30 days before their estrus cycle, or they're actually in estrus, their basal thyroid levels will be lower than they are otherwise. So that's not the time to get an accurate diagnosis for genetic screening, or if you have a healthy pet trying to figure out what's going on, or even if you have an ill pet during an estrus cycle. The basal levels of thyroid hormones will be changed. Now, if the animal is pregnant, or in the first 60 days after a heat cycle, when you can get pyometra, or an infected uterus, the basal thyroid levels are often higher than they are otherwise. So again, sex hormonal changes affect thyroid function. Now finally, rabies vaccine, if it's used 45 days before the testing is done, can increase the level of thyroid autoantibody, but not very high. Now we're going to switch and talk more about abnormal behavior. The biggest reason for euthanasia, or putting pets to sleep, in a pet home is undesirable behavior, because with the crazy lifestyle we all lead today throughout the world, we are working hard, everybody in the family's working, all the children are going to school and hopefully university, we're all developing our careers, we're running through life. And when we get home, we cannot keep or abide by a dog or a cat or a bird or another pet that has undesirable behavior. We just don't have the patience for it or the tolerance for it. And sometimes the pet that's not feeling right will behave abnormally because it's trying to get attention from you, to say, look at me, I'm not well. And of course that just makes it worse because the behavior can't be tolerated. So the association between behavioral problems and psychological changes with thyroid dysfunction has been recognized in humans since 1930, the work of Plowman and his colleagues. So thyroid function, especially in young children with psychological changes and behavioral changes, has been a problem in people for a long time. As many as 2/3 of human youngsters, young children, young 3, 4, 5, 6-year-olds up to puberty and teenage years with attention deficit hyperactivity disorder are hypothyroid. And if those youngsters are diagnosed properly and treated with thyroid hormone, they retain and develop normal behavior, rather than giving them Ritalin and other behavioral modifying drugs to change their behavior and make them, quotes, zombies. We give them thyroid hormone. So it's very important for young people that aren't acting correctly or as expected in a home to be tested completely for a thyroid problem. We see the same thing in dogs with autoimmune thyroid disease and just regular thyroid dysfunction, where the dogs have hypo, remember, and cats are hyper. So what do we see? Unprovoked aggression. You come home, your pet is so anxious to see you, happy to see you. You open the front door, you open the front hallway, and the animal attacks you at the throat, trying to get your attention, saying, don't bother me, I'm not well. Suddenly they start to have seizures like epilepsy. Now, this is not heritable epilepsy that occurs in young puppies or kittens. It's not so common in kittens. These are sudden onset seizure disorders at or after puberty or in young adults that are 2 or 3 years of age. The animal can suddenly be disoriented. Who am I? Where am I? Where am I going? And I'm not a geriatric that has cognitive dysfunction of old age. I can be moody. One day I'm friendly, the next day leave me alone. My temperament can be up and down. I can be hyperactive. I can run around the house like an idiot. I can go into the backyard and jump and play and act and bother all the neighbors. I can be crazy hyperactive. I cannot pay attention. You talking to me? I didn't hear you. I'm not paying any attention to you. Animals can be depressed like people can. So don't forget, within a household where some tragedy is occurring or an animal or another person is ill, animals can feel depression as well. They can be fearful. They can have phobias, as I told you before. They can be anxious, as I showed you in the pictures. They can be passive. You can do anything to me, I don't care. I'm a limp rag, dish rag. I can be submissive. You pet me, I'll pee on you. I can be compulsive. I'm taking the baby's toy. Yes, I am. I'm getting in the bathtub with the baby. Yes, I am. Or irritable. Don't bother me today. I'm going to hide under the kitchen table. Don't come near me. And then a few hours later, I'm fine. Why don't you hug me? Why are you ignoring me? It's very concerning. So the behavioral changes can be subtle personality and behavioral things that can indicate deterioration of the thyroid gland. So this animal is sad, it's anxious, it's withdrawn, it's submissive, it's aggressive, it has anxiety, it's depressed, and it's very sensitive to noises or other objects it doesn't want around it.